A very good afternoon to our judges and all present. I have a 7-year-old boy and this is his immunization record. Notice the last entry on this was 2014. This cheeky piece of paper decided to go into hiding for 6 years. Well, that's the story I'm sticking by, just don't ask my wife. Fortunately for us, we have a good pediatrician and my boy is fully vaccinated. However, when it came to the time for him to register for school this year, one of the requirements from the school was this record. They called it BukuPINK, and for the life of me, I couldn't find anything pink. I mean, he's a boy. But in the end, I had to have our doctor scribble on a piece of paper all the vaccination dates, chop and sign it for me to complete the school registration process. So here we are looking at the problem that's common to all new parents. The immunization record is a manual documentation process and therefore is susceptible to be misplaced, forgotten, or even destroyed. There is also the risk of records being inaccurate from human error. As it stands now, there are no formally adopted systems that provide proactive reminders for vaccinations. It is entirely dependent on parents' discipline and motivation. And for doctors serving rural areas, there are further challenges of educating the importance of immunization for children. The obvious answer to this issue is digitization, of course, as stipulated in the hackathon's problem statement. As obvious as it sounds, though, this process isn't as straightforward as the statement on the screen. There are literally hundreds of regulatory barriers to this digitization that will require parliamentary intervention to remove, and that process may take years. I was on the core team of the National Regulatory Sandbox in my years at MYHAC, and one of our first clients is the Ministry of Health. I have witnessed firsthand the challenges of executing this. And it is from this experience that this team has decided that we will tackle this problem with a more practical solution that doesn't require a lengthy regulatory review process and can be implemented within the 12 months we are required to. We have designed a solution that is flexible and open so that when the laws and acts are eventually reviewed, it can be integrated with our system immediately. Allow me to introduce our solution to you, BukuPINK, the digital edition. BukuPINK is the ultimate solution for the process of recording and keeping track of your child's health conditions from antenatal to pediatric. For the more conscientious parent, they can start the program from early stages of pregnancy, or at the very least, appointment reminders for checkups, and continue using the app all the way to prenatal and medical records of their child. The app will feature prenatal records not limited to just medical information. They can have digital diaries for their baby's first moments, a calendar for important dates to keep, and a huge database of knowledge for parents on common parenting issues. From the medical practitioner side, we have the complete package for OBGYN records. Whenever required, the app will generate for you the vaccination history of your child. There may come a day when the law will require children to be fully vaccinated to be allowed in school or other related community activity. Our solution also includes the maternal records for mother's well-being, such as delivery notes, postnatal care, etc. The same thing is applied for infant records that are important for fast and easy access whenever needed. Even in its early deployment stage, the system is designed to maximize its impact, reducing no-shows for important checkups, which will lead to an increase in follow-up appointments. Doctors are able to upload daily reports and analysis on their patients and procedures. Even lab reports can be uploaded to the system without needing the patient to visit the clinic for results. Upon full integration with full compliance to governing laws and regulations, healthcare providers will be able to access patient data, make fetal assessments, and prescribe medicine online. This solution makes patient appointment management a simple process for both patient and healthcare provider. Deploying BukuPINK is a straightforward process with a fast turnaround period, providing intelligent information to all parties. We are the better choice as our deployment is intended to disrupt the process and practices, but not the system, and as such has a low entrance barrier and interdependency on legacy systems. The solution can be implemented in stages without disrupting the operations due to its microservices architecture. We have planned a practical deployment strategy that minimizes disruptions in clinical operations and processes. We have planned our pilot in stages and identified the potential clinics to participate. This is just phase 1. We have chosen this project based on our passion and our abilities and experience. The core team leading this project consists of key people with the right experience to see it through. We are also backed up by an experienced advisor in the relevant field, and her first duty is to tell us off when we try to pandai-pandai. So choose BukuPINK and let us make this a reality for a healthier future generation. Thank you very much.